Good afternoon, good evening, good morning from wherever you're joining us from. My name is Dr. Jemima Karaoke. Welcome. Today we'll be discussing about postpartum sepsis. This has been triggered by one of our members who sadly succumbed to postpartum sepsis. So we thought to be wise to really take through all of us on what to expect, what is the right thing to expect, how do you identify sepsis, and of course the management. So with me today, I have Dr. Lucina, I have Dr. Caro, both from Wheels for Life. So I'm going to allow them to introduce themselves, and then we can jump straight to postpartum sepsis. Welcome once more, and thank you for your patience with us.
Right. Hi, everyone. I'm Dr. Lucina. I'm part of the team here at Wheels for Life, one of the doctors who will be chatting with you on our app or when you call us or on WhatsApp. So yeah, today we've prepared a small presentation on sepsis. We've done a bit on a puerperal sepsis, which is basically postnatal sepsis, and in you as a postpartum woman, and a bit on neonatal sepsis. So how to know if your baby is okay and at what point you need to go to the hospital. Yeah. Doc?
Karibu sana, Dr. Lucina. Dr. Caro, we can also introduce you because we're starting from here. And then when we get serious, we get serious. So they're both in the same facility, so don't get shocked when you see faces moving. Is she around?
She's having an issue with her phone, but she can introduce herself.
Yeah.
Hello, everyone. My name is Dr. Modoni, also part of the team from Wheels for Life. Our facility is up and running, so that's why we are all over the place. But looking forward to having the conversation with you and letting you in on everything about infections after birth. Thank you.
Awesome. Thank you so much. So Dr. Lucina, I'll allow you to start. If you're joining us, Karibu Sana, we'll be doing postpartum sepsis as our main topic of interest today. So Dr. Lucina, go ahead.
Okay. So yeah, what we want to talk about today is postpartum sepsis. So when you hear this term, I'm sure a lot of you have an idea what it is, but let's get into the details or like the correct terminology to use when defining this condition. Next slide, please. Thank you. Yeah. So what is it? It's basically an infection of your genital tract occurring at labor or within 42 days of the postpartum period. Genital tract includes anywhere from your perineum, vagina, cervix, and the uterus. And as you can see, within 42 days, this is about 6 weeks postpartum. So within this time, any infection can be categorized as postpartum sepsis. So there's a couple of things that can predispose you to a higher chance of getting postpartum sepsis as compared to the other population. Some of these things include smoking, alcohol use. For instance, if you are diabetic or if you have hypertension, lack of proper wound care, which can include, for instance, if you had an episiotomy done where they cut a bit to allow more room for the baby to pass through, or if you had a tear during vaginal delivery. So without proper care of that wound site, it can lead to infection. If you have an STI at the time of labor, and if you generally have a weakened immune system for autoimmune diseases, HIV, AIDS, these things can lead you to be having a higher risk of getting sepsis as compared to people who don't have or participate in any of these other things. So if there's anything modifiable that for instance, smoking and alcohol use, these are things well within your control. You can cut down or eliminate completely. That will help reduce the risk. For things like diabetes and hypertension, controlling these conditions well, meaning regular visits to your doctor, or even here for to make sure that your sugars are in check, your pressure is in check. These are some of the things you can do to help avoid getting infections. And like I mentioned, when you have the wound, proper wound care includes things like sitz baths and just generally maintaining a very clean area when you post after delivery. Yeah, so those are some of the things that you are well within your control. If you have any infection, STI, you should have that addressed immediately before the infection sort of escalates further. Yeah, so things you feel you can control here, not things you feel, but things you definitely can control, you should definitely do that. Yeah, can move on. So what are some of the signs and symptoms of postpartum sepsis? So if you're feeling, just sickly, you have fever, high temperatures, chills, or as people like to call it, feeling like malaria or whatever. If you're having pelvic pain, abdominal pain, urinary symptoms, we'll talk further on that, but these include, when normally, you're not able to hold. When you're pressed, you need to go there and then. That's called urgency. If you keep going to the bathroom every 2 minutes, you just came back, but you're already feeling pressed again, something we call frequencing. A pain during urination, and also the foul smelling discharge. There's the normal, what we call lochia after delivery, the normal discharge that you have, but this discharge should not be foul smelling. So once you find it's having an odor, you might need to get that checked out. Having diarrhea and vomiting, those are just some of the other signs. Also, if you had a CS, then the wound will be clear and it's an infection. You'll have pus on the wound, a lot of tenderness, pain. Yeah, so those are just some of the signs and symptoms, but we'll talk more on that on the next slide. Could you zoom in a bit on that, Doc? Oh, okay. Oh, my eyes are so bad. Just give me a minute. I hope you can still see me. Doc, you can see me?
Yes, we can't at all.
Oh, okay. All
But
right.
we can hear you. Okay, we can see you.
Can you zoom in a bit? It's a bit.
No problem. No problem. Better?
Yeah, that's better. So this page basically what we said about what puerperium sepsis is and what are the signs and symptoms to look out for. So some of the other symptoms that I've not mentioned maybe is passing clots and big. The discharge after labor should be, reducing as time goes. But now, if you notice passing huge clots and, like I mentioned, with an offensive odor, you'll need to be seen by a doctor. Excessive vaginal bleeding and severe pain or touching of the lower abdomen. So there's a when you talk about postpartum hemorrhage, usually there's within the first, the 72 hours of birth, but then up to 6 weeks, you can have something called secondary PPH. And this one is usually caused by infection, which is now the sepsis. So if you start having a bleeding, you need excessive bleeding, you need to be seen by a doctor. The urinary infections symptoms I was talking about earlier, like increased need to pass urine or pain when you're passing urine. And on the wound side, if you had an episiotomy done, where we talked about what that was, they cut a bit on your perineum to just allow more room for the baby to pass. you might need to have, it depends if the stitches they used, if they're stitches that need to be removed, or they are absorbable. So if your stitches or wound are infected, the stitches, if they overstay, if they use stitches that aren't absorbable, you need to also make sure you go back at least a week or 2 weeks after the procedure was done to have them removed, because they can also get infected. You'll notice pus, you'll notice an offensive smell, unusual pain, and tenderness in the area. Also, another sign to look out for is if your breasts become infected, which is now called mastitis. They may appear red, swollen, painful, hot to touch, and a burning sensation during feed. So generally very uncomfortable during this time. Sometimes you may even have pus coming out of the nipple. So in cases like this, we can actually just have another session dedicated to this, or Doc will talk more about this. But in cases where you do have the mastitis, it would be advisable you can continue breastfeeding on the non-affected side and allow this other side to heal. Yeah, we can move on. Yeah, so that's pretty much it for when it comes to mom. When we're talking about puerperal sepsis, obviously, if you have any of those symptoms that I've mentioned, or you need to be seen so that we can advise on the way forward, on the proper medication to commence at that point. But now, if you're concerned about your baby, how do I know my baby is okay? Because babies can have sepsis. What sepsis generally means is when you have an infection that is blood, it has spread to your blood, now it's seeding to other organs, which in the end, ultimately, it can cause end organ damage to any and all organs you can think of. So it's better we don't get to that point. And this can also occur in babies. So for the baby, how will you notice this early? So if your baby is running high fevers, they're feeding poorly, they might even just be refusing to feed altogether, just not their usual self. They're vomiting persistently, they're having convulsions or fits, they're having difficulty breathing, and by difficulty breathing, you can notice they're making sounds that are not normal when they're breathing. You can maybe hear wheezing, you can they look like they're struggling while breathing. This is something that is one of the more severe signs of sepsis in babies. Also, if the baby is just very lethargic, by lethargy, we're talking about they're not as active as they normally are. It's maybe difficult to arouse them. And also on the other end is they're excessively irritable. They're just crying, will not stop crying, and inconsolable, basically. Yeah, and then you can also, for the umbilicus, you can look out for pus. If the umbilicus the stump was not healing well, this is a point entry of infection for a lot of babies, actually, and this can lead to sepsis. So it's for such cases, when the baby, will need to assess them to know if the level of sepsis is severe or just mild or moderate, and from then you can advise. Some babies will need admission for IV antibiotics and monitoring, also IV fluids, and some even need NG tubes to be able to feed them to maintain, the energy. So that is a decision that is made case by case and by a doctor. And like I mentioned, a drowsy or unconscious baby, a baby who's basically you're unable to arouse them. You're trying to wake them up, or even if they're waking up, they're not really as fully alert as they normally are. So those are just some of the things to look out for in your baby. If you notice any of these ones that I've listed are more of the severe signs. So these will need you to come to hospital. But if you can reach us through the app, the Wheels for Life app, for further, if you're unsure, you can also consult us over the phone. We'll let you know if you need to come in. You can call us through you can text on the WhatsApp groups where we'll be able to interact and be able to advise you. Or you can call through 1196, which is our toll-free app where we can direct you further. Yeah, that's pretty much it. I'll let Dr. Jemima get into the details, what I've talked about. Oh, yes, and you can come to our clinic is at New Garden Estate Road behind Mountain Mall off Thika Road. We are available here for in-person consultations. Yeah. Doc, over to you.
Thank you very much. Thank you so much. Wow. I'm really happy. I don't know if there are any questions so far. Let me just post here. Kindly post your questions as we go. Thank you for the overview. I think I'll highlight more on postpartum sepsis for the mother and take it a bit more in depth, especially for SVD and cesarean births. And then please stay on the background in case of any questions. You can be typing in the responses as we go. So we want to take another 20 minutes and then we should wrap up.
Right.
So thank you so much, everyone. Again, we are speaking about postpartum sepsis. There are very many things that can go wrong when it comes to delivery, and sometimes they do go wrong. But one of the things that we can prevent is loss through sepsis. When we talk about the big fives in delivery, there are 5 big things that can cause maternal death. Sorry for that. Number 1 is obstructed labor. Obstructed labor is where you've been 8-9 centimeters for long and the head is not coming out and we're not able to get the head down no matter what we try. So it can be due to various causes, but the most common is CPD. The second cause can be hypertension in pregnancy. I'll dedicate a day for hypertension in pregnancy. But that's also something that is quite preventable, quite repeatable in various pregnancies. So if you've had one in the previous pregnancy, you can expect it to reoccur, and therefore we prevent it early. The third one is sepsis. And sepsis is now just infections, whether post-abortion infections, whether post-delivery infections, whether mastitis. Infections generally is a third leading cause of death when it comes to maternal and child health. And then now we have shock or hypovolemic shock or bleeding. And of course, that's a major issue. And the last one, unfortunately, is actually harmful abortions. So we'll also discuss that at a later day. So today we're dealing with infections. And the one thing to know is that post a delivery or even a miscarriage, if you start feeling like you're getting feverish, a fever that is sustained for 24 hours or is on and off after the first 24 hours, that's a cause of alarm. Okay. The other alternative is if you get lower temperatures, which you call hypothermia. You're just feeling cold and chills and what have you, and it's not because we've given you a drug that gives you chills. That's another thing that can cause hypothermia. That can be an indicator of infection. Another thing that can cause infections, and now will tell us if you have an infection, is pain, abdominal pain. So remember, the uterus resides in the lower abdomen, and as you deliver, it starts contracting to go down back into the pelvis. Yeah, so that's the usual physiological thing. But you may find that there's so much pain beyond what is normal. I know that's almost an oxymoron, but when you breastfeed, there's a level of contraction pain that you will feel, that will feel like the cramps of your periods, maybe slightly more intense. But if you get a painful abdomen that is now moving from that area of lower there to around the entire abdomen, and regardless of whether you're breastfeeding or not, then you may need to check whether there's something else, especially after the first 2 or 3 days. Then that's really a marker for there's a problem. The third one is if your heartbeat is a bit too fast. We call that tachycardia, when your heart is beating a bit too fast. We can pick it very fast from doing just your usual blood pressure and heart rate checks. But if you're outside the hospital and you feel your heart is beating a bit too fast, then also that's something that we need to check. Okay. The fourth thing that is important to check is vaginal pain. There's a usual pain that you get, especially if you've delivered normally. There's the stretches and you had a stitch done, so it can be painful. But after some time, it becomes almost like numb. How do I explain? It's like a slow amber tone. But if it's consistent pain, no matter whether you're peeing, whether you pass stool, like you're just sitting down, it's too painful, you can't even sit down, then you need to check, am I having an infection? And if your partner is with you, you can just have them check whether there is pus. Okay, as Dr. Lucina was talking about, pus anyway is bad. It's really, really bad. So pus anyway is bad. But you also check whether there's a foul smelling discharge. The only smell that should come from down there is a smell of blood. So if you start getting a smell that smells fishy, it smells just malodorous, whatever that may be to you, come to hospital. So I'll not describe what a bad smell is, so that if you pick something that is abnormal, just come to hospital. And we all, if you're female, you've had periods before, so you know what the smell of blood is. So if it's anything other than the smell of blood, please come to hospital. Okay. Another thing is if the stitches are coming out or you feel like they're gaping, please come to hospital, because again, it could be gaping because there's a wound behind there. Yeah. If you've had a cesarean birth and there's a swelling around the scar site, and the swelling is associated with pain, and when you touch, it's a bit hot, that's also a sign of an infection within the wound of the cesarean. So if you see that and the pain is constant, it's difficult to sit down, like it's just pain throughout, we know it's a big surgery, but because of the painkillers we give, after about 3 or 4 days, the pain sort of subsides. And I've had a cesarean twice, so I can, at least that's one I can attest to. But if you have consistent pain throughout and you can feel there's a bumpy area and it's a bit hot to touch, please, please, please come to hospital and let them check the wound and then press. Sometimes when we press, we actually get pus. And we need to now consistently do that so that we remove out all the pus and allow healing. Please don't stay home with a pus on your scar site, whether it's in the vaginal area or whether it's in the cesarean area. Okay. So I think those are the ones I really wanted to highlight because they're the major ones. If you had issues with anemia in pregnancy, your HB was below 12. We say 11, but I'll go to 12. If your HB was below 12 and you're feeling weak, tired, lethargic, feverish, just tired and just sick, please come to hospital. It could be your immunity is already weakened because of the anemia, as Dr. Lucina highlighted. And then now, because of those two, the process of healing is not going in the way it should. So we may need to boost your healing process and check that you're not getting an infection. When you get to hospital, we'll do your full your full hemogram, which you call a total blood count. Okay, you will do a full hemogram, which we'll call a total blood count, and then we'll do a CRP, which is a C-reactive protein, just to see whether your infective markers are high. We'll do a physical check just to make sure that there's nothing wrong. Of course, we'll do your vitals to make sure that to just see how the heart rate is doing, and then all those summed up will let us know whether we're doing daily dressing and cleaning with antibiotics, whether we're giving antibiotics, whether it needs it or not. So it's really, really important. Now, the predisposers to getting an infection are obesity. If your weight or your BMI is above 30, that's a big problem. Yeah, because healing is slower. If you had a cesarean wound, then the healing takes much more longer. You have more fat tissue. The fat tissue is able to undergo necrosis. So it's important for you to be extra vigilant if that's one of you. If you had hypertension, if you have diabetes of pregnancy, those are things that weaken your immunity, and therefore you may have a longer time to heal. Okay. Anemia, as I've mentioned prior. If your cleaning habits may not be the best, in the West they call it if you come from what is that way they describe it? Minority. If you come from the minority area, but that just means if you have poor nutritional habits, you're not eating well. Now, let me pause at poor nutritional habits. We all know that during that period after delivery, there's a lot of warmth and love usually from moms and older moms who come and try to give food and give warm what are they called, warm porridge, warm milk, warm soup, warm all those things. And of late, most women talk about, oh, I don't want to get a potty, so I'm not taking wheat, or I don't want to get a potty, so I'm not taking porridge, or I'm not, all those things. Remember, when you've just delivered, your nutrition is literally going to feed you and your baby. And while we say it's 3 times more water, we say 3 plates and one more extra for food. Remember, the type of food that we are talking about is a heavily nutritious meal. Some talk of a high protein diet with high fluid intake so that you can rebuild all the blood that you lost, all the cells that you lost during that whole delivery period. And please don't ignore that. Don't ignore the place of high protein intake, because the more you're taking your proteins, the more you're increasing amino acids so that you can build more healing proteins. Okay. And remember, the things that we used to be told to eat to increase milk were plant proteins. Njahe in my culture is njahe. You know, njahe is black beans. It tastes nasty, but it has a lot of protein. Sorry for that. So that's one of the things that I will talk about. Just the kind of nutrition that you have. Let's eat a high protein diet, eat a high fluid diet. Can I, like soup? If you're taking a lot of soup, bone soup, that is very good for you. It has a lot of minerals, it has a lot of protein, etc, etc. So don't negate the place of eating for the sake of coming back soon. You know, I want to pop back. So you will lose all the weight after 6 months. Don't worry, you lose all the weight. So that's one thing that I would really talk about. That is controllable. Lucina was talking about the things that you can control. I think if you control your diet and exposure to outside, you've dealt with half the problems. And we tend to think it's just infections. We tend to think it's just vaginal infections, but infections of any kind can bring you down during postpartum. By that I mean, if you pick up pneumonia for example, you went from anyone, someone came to visit you at home and then they were coughing and you pick that up, then it will go to your chest, it will find a weak immune system, and then it can cause you to get septic shock from pneumonia, but it came in postpartum. So we'll still look at that as infections post-delivery. Okay. The other thing that you can pick up is mastitis. Breastfeeding initially is rather painful. It's really rather painful. So when you have pain during breastfeeding and then it starts getting an abscess, so what you'll find, it will feel tender and hot, and then you'll feel like it feels like a stone. Yeah, it actually feels like a stone, and it doesn't produce as much milk as you thought it would. So if you're breastfeeding only, you may not, and not pumping, you may not realize the consumption has reduced, rather the production has reduced, but you'll notice baby is feeding and you're feeling more pain even as they're feeding, and this block or this stone is not relaxing. Then you start thinking this is mastitis. It's an infection of the breast, whether the breast duct or something else. Yeah. So if you ignore that pain, that breast pain, it can develop into a breast abscess where that milk coalesces, mixes with bacteria, and then it becomes a breast abscess. You get, so it's a nasty thing. You now have to come and drain, and it's still producing milk. So it's messy. Yeah. So because of that, if you see the signs early, just have it checked out. Okay. The other thing is endometritis. Endometritis is an infection of the lining of the uterus. How you will know this is you'll have a lot of pain in the abdomen. No matter what you do, there's a lot of pain in that abdomen. When you go to pass urine, you'll feel a lot of pain. When you're going to pass stool, there'll be a lot of pain because it's touching on the uterus. And then it will have foul smelling discharge. Don't allow it to get to pass. Again, foul smelling discharge, pain, go to hospital, be treated of an infection. So the stepwise way that this cascade to get to that point where you're getting infections and bleeding and what have you. Rather, yeah, infections and bleeding, it can actually give you bleeding. Is you'll get the bacteria eating on the area, in that area, be it pneumonia, it would be your chest, be it the breast area, mastitis, which will be around the milk, be it the CS, post-CS area, it will be around the incision scar or inside, be it the perineal area, especially if you've had a vaginal delivery with stitches, it could be a UTI, because when we're delivering, sometimes we can lacerate, or there can be a small irritation or a lot of irritation near the urethra, because it's just above where the vagina is. So here's a vagina like this, then on top here is a urethra. So you can get a UTI. So whether you get all of these symptoms that Lucina was rightly talking about, the next thing that you will feel is pain. Pain is the body's way of telling you there's an infection. Then you'll get a fever. Then you'll get an increased heart rate. Then it will coalesce to pass. And then now it will go down into body lethargy and just tiredness and fatigue. And then all the way now till your body organ starts shutting down. Okay, so before we get to all those things, until now you're unable to talk, unable to breathe, and then your fever shoots, your BPs drop, and you collapse, there's a big window for you to go to hospital. So please go to hospital. And I know there's a strike. If you're affected by the strike and you feel like you're postpartum, there's a problem, call 1196. We will pick up, we will help. If you're on the platform, on the WhatsApp platforms, please WhatsApp us, especially if you're in the Gold Group WhatsApp, let us know. If you're not on the Gold Group, please also post on the WhatsApp group. We will still see, we will DM where we see it's an emergency and we will help. Okay, so don't don't struggle in vain. If you need somewhere physical, we are present. Wills for Life Hospital is present. It's at Garden Estate. But if it's not near you, you're in Kisumu, you're elsewhere, go to a mission hospital. If you plan to use an HIF and what have you, go to a mission hospital. If you can't, go to a private hospital that uses an HIF, or one that is affordable for you, but don't stay home in silence. Yeah. And the best way is usually if you delivered here and it's still accessible, you can go there. If they have your file, it'll be easier to treat you. If they're far, please, telehealth is here. We are here to serve you. Please. Yeah. Don't struggle at home if you can get help. Tafadhali. So I think that was the one thing that I'd really want to highlight. And the treatments are so simple. Antibiotics, most often than not, will work. Depending on the kind of infection, you will need to change the kind of antibiotic. And of course, if you have pus, it has to be drained before we can think of those antibiotics. So again, don't pre-treat yourself at home. Get medical aid so that it can be reviewed, and then we can treat. So I hope that has answered a question or two. I don't know what I may have left out. So now I'll just answer the questions I'm seeing here. Yeah, so kindly post your questions as we go. Jackie, thank you so much for being so present. I can see you're already having a consultation. I'll have you and Lucina move to the app or to WhatsApp so that we can continue. But you're saying that your HB was 12, but you feel dizzy sometimes. Now, we need a bit more history. Do you feel dizzy when you're breastfeeding? Do you feel dizzy afterwards? But if it's on and off, is there any fever? Is there any is there any fever? Is there any loss of consciousness? If there's any of that, please go to hospital. The other thing that could cause dizziness usually is dehydration while breastfeeding. So if you're breastfeeding and you start feeling dizzy, you may need to just drink water as you are breastfeeding, or you drink cocoa as you're breastfeeding, so that your baby is not overwhelming you by the amount of fluids that are coming out at a go. You get? Yeah. But if it's only, if there's any headaches that is associated with the dizziness, any fever, this dizziness, you've actually fallen, please head to hospital so that it is carefully assessed. Your vitals are taken, especially your BP and what have you, so that we see that all is well. The other thing is that you could have lost a lot of blood during childbirth. I can see here you're saying you're 5 days post-delivery. So it could be that you lost a lot of blood during childbirth, and therefore it would be important to have your HB redone. And then you need to be on supplements, okay? So supplements being IFAS, which is iron. It could be continuing with your pregnant care or whatever pregnancy supplements you are on, so that your body, as I said, is still healing. So you need to keep on helping it to heal. So ensure your diet is very good. Here is Lucina talking about diet. Ensure you're eating well. Ensure you're drinking as much water as possible. If it goes beyond dizziness to headaches, palpitations, that's your heart beating fast, fever, head to hospital immediately. Okay. Bridget is asking if we talked about sepsis. That's all we've talked about. Sepsis means infection that has gone into the bloodstream and is affecting now other body functions. So yes, we've discussed about sepsis at length. After this, this video is going to be on YouTube, so we can all replay it. If there's still a question, feel free to DM or to even post on the YouTube page, and then of course we will respond. Also, if you're here and you've not subscribed, please hit that subscribe button. It goes a long way for us. Hit that like button and please share as well. Yes, so I don't know if there is anything that I have missed out. All right, so I think that's it. We've responded to each and every question. I want to say thank you so much. Thank you to Dr. Lucina, Dr. Carol as well for creating this beautiful presentation. If you don't mind, we're going to send it to the group so that they can at least see and read through it, and then we can, of course, answer the questions as they come. So I can see here those are questions on wheels on how to handle UTI. Oh, thank you, Bridget, for that. I hope the person who was asking is on this platform. So how to handle UTI? Number one, identify it. How do you identify UTI? It will have 4 symptoms usually: painful urination, either at the beginning, in the middle, or at the end. If you get it in the beginning, we know that's a different type of UTI as if you get it in the middle or at the end. You may feel a burning sensation. So a burning sensation when you want to pass urine, although Lucina had spoken about all these things. You may feel the burning sensation, may feel suprapubic tenderness, which means just pain around the pelvis area, especially when you feel pressed. The fourth one is you frequently feel like going to the washroom, and when you go to the washroom, there's not much coming out. There's little pee coming out, so that tells you that you may be having a UTI. What can you do at home? What you can do at home is drink a lot of fluids. Yeah, drink a lot of fluids. If you can get cranberry juice, the better. It also helps with reducing the microbes. Over and above drinking the lots of fluids, please go to hospital. You'll be given antibiotics. They'll do a test first called a urinalysis. The urinalysis will tell us whether it's a bacterial infection or otherwise, and then that will guide us on how to treat and what antibiotic to use. Okay. And then there are things we call urine alkalinizers, urusol, uricane, and what have you, which are taken by people who had recurrent UTI. Okay. So that's the management. Of course, painkillers. Painkillers we would restrict to just paracetamol, because if you take the diclofenac and what have you, they may impede the body trying to actually heal or treat the body. Yeah. So some of the things that they block pain also block the body from being able to fight bacteria or germs. Okay. How to protect yourself from getting a UTI. If you're using public washrooms, please, when you enter the washroom, flush the toilet first. Okay. After flushing the toilet first, take a lot of tissue and just put on the basin, so that there's no splashing. Okay. Avoid sitting on the toilet bowl, unless it's those you lose where you have sanitizer that you can sanitize the toilet bowl. But I would not suggest it. Don't sit on the toilet bowl. Okay. So just line the tissue, line the toilet, line the basin, and then you can pee as you need. Okay. And then afterwards, flush the toilet again. That would be what I use. If you find the toilet is dirty, there's any fecal matter pigmentation, just don't use it unless you're really, really pressed, and then now you can cover it. So I hope that answers your questions. Bridget, I hope that answers the question. Yeah, so thank you once more, especially Dr. I want to bring Dr. back on stage. Yes. Any last words?
Yeah, thank you so much for joining. We are ready. We're always here on the WhatsApp platforms to answer any of your questions. Yeah, stay tuned for the next webinar. We'll decide on a topic and we'll let you know.
Awesome. Again, thank you so much. Bridget says thank you so much, and God bless you for the amazing job that you do. Thank you, Bridget, and thank you for supporting all the moms in the group. We appreciate you. We see you. Mwah. So as I end this stream, let's meet on the WhatsApp platforms. If you're not in the Gold group, it's only 150 shillings a month only. We have the clinic you can come to. We have the app you can reach us. Literally, you have no reason not to interact with us. Thank you. God bless you. And may the Lord be with you. Bye.
Bye.